What if the reason you can't lose that belly fat, you wake up exhausted, and your memory keeps slipping tone, has nothing to do with aging?
Right now, 88% of adults over 60 have some form of insulin resistance, and most of them pass their last blood test with flying colors.
Today I'm going to walk you through 9 signs that your insulin is already too high. Signs your body is sending you right now, this week. Most of my patients recognize at least 5 of these. But stay with me until number 1 burrows, because number 1 isn't a symptom at all.
The good news is that every one of these signs is reversible, and I'll show you exactly what to do about it before this video ends.
Before we get into the 9 signs, I need to explain one thing, Creo, because without it, none of what I'm about to say will fully make sense.
Insulin is a hormone produced by your pancreas every time you eat. Its job is to move sugar out of your blood and into your cells for energy.
When your cells stop responding to that signal, your pancreas panics and pumps out even more insulin, trying to force the door open.
That excess insulin in your bloodstream doesn't just sit there. It drives fat storage, inflames your brain, and stiffens your arteries. And your annual blood test misses all of it. Because your doctor tests glucose, not insulin. Those are 2 completely different numbers.
Over 21 years, I've seen these 9 signs repeat themselves in patients who were told they were completely healthy just months before. Some of these will feel so familiar it will stop you mid-video. That recognition is your body talking. Please don't ignore it.
We start at number 9 and work our way down. The further we go, the more systemic and dangerous the pattern becomes.
And as I promised the Poe, number 1 is not a symptom, it's a pattern. It's the thing connecting every item on this list. Let's get into it. Sign number 9, skin tags. Those small, soft growths on your neck, armpits, or under your arms. They look harmless, Ty? They're not.
Skin tags form when excess insulin stimulates rapid cell growth in areas of friction. They are a visible marker of chronically elevated insulin.
Sign number 8, dark patches of skin hum, usually on the back of your neck, your elbows, or your knuckles. In medicine, we call this acanthosis nigricans.
Those dark patches are your skin cells responding to insulin overload. This is one of the earliest visible signs of serious insulin resistance.
Sign number 7, you feel hungry again within 2 hours of eating a full meal. That's not normal. That's an insulin spike followed by a crash.
High insulin causes your blood sugar to drop too fast after meals. Your brain interprets that drop as starvation, and it sends the hunger signal.
Most people blame willpower or stress for constant hunger after 60. It isn't either. It's a metabolic signal. Your insulin is driving the wheel. Those first 3 signs are visible and physical. The next 2 are harder to see, Tal, but they are the ones my patients always say they recognized first.
Sign number 6, brain fog. You can't finish a sentence. You walk into a room and forget why you're there. You reread the same paragraph 3 times. Chronically elevated insulin reduces blood flow to the prefrontal cortex, the part of your brain responsible for memory, focus, and decision-making.
Most doctors tell patients over 60 that mental fog is just aging.
Yep.
In my practice, it's often the first sign that insulin has been elevated for years.
Some researchers now describe Alzheimer's as a form of insulin resistance in the brain. It's a hypothesis, too. Sign number 5, you are exhausted, not tired, exhausted. You sleep 8 hours and wake up needing coffee immediately just to function at a basic level. When insulin is chronically elevated, your cells become resistant to it, meaning they can't absorb fuel efficiently, even when glucose is available.
We're now at the midpoint of this list. The next 2 signs involve your cardiovascular system, Crego, and this is where the real danger starts compounding.
Sign number 4, your blood pressure keeps creeping up Cayman, even if you're watching your salt, exercising, and taking your medication as prescribed. High insulin signals your kidneys to retain sodium and water. It also causes your blood vessels to constrict. Both of those raise blood pressure.
Many patients I see are on 2 or 3 blood pressure medications prone, and not one doctor has ever checked whether insulin is the root cause. I am not saying to stop any medication. Always discuss changes with your physician. What I am saying is the root cause is treatable if you identify it.
Excess insulin activates an enzyme that converts unused glucose directly into triglycerides, fat particles that accumulate in your bloodstream.
In a healthy, insulin-sensitive adult, fasting triglycerides should be below 100. Above 150, I start asking serious questions about insulin. The path out of this is not another diet. It is lowering insulin first, and then the fat loss follows. I'll show you exactly how in a few minutes. But first, number 1. Because understanding what connects all of these signs together is the most important thing I can give you today. Every single sign I've described, and from the skin tags to the belly fat, has one driver, not multiple problems, one, and you've never been tested for it. What I'm about to tell you is the reason signs 2 through 9 exist in the first place. It changes how you see everything on this list. Sign number 1 is this: you have never had your fasting insulin tested. Not once. And your body has been trying to tell you about it for years.
The absence of a single blood test is the sign. Because without it, every other finding on your chart is being interpreted without context.
Answers. A fasting insulin above 8 UU/mL begins to indicate resistance. Above 15, and we need to talk.
You can request this test at your next appointment. It costs almost nothing. It's called fasting insulin growth, or you can ask your doctor to calculate HOMA-IR.
Most standard metabolic panels don't include fasting insulin automatically. You have to ask for it specifically, by name.
Yeah.
And it changes everything.
In 21 years, this test has guided more treatment decisions in my practice than any other single number. More than glucose, more than A1C combined. Now, Craig, here's what you can actually do. Because knowing you have a problem without a path forward is not useful. Let me give you the 3 starting points.
First, a 10-minute walk after your meals. Not before, after. Muscle tissue captures glucose without needing insulin when it's active. A 10-minute walk after dinner reduces the post-meal insulin spike by up to 30% in clinical studies. It's the cheapest intervention we have. Second, protein in the first meal of your day. 20 to 30 grams. Eggs, Greek yogurt, cottage cheese. This anchors your glucose for the entire day. When you lead with protein instead of carbohydrates in the morning, your insulin response to every subsequent meal that day is significantly blunted.
Third dame, a 12-hour eating window. Not extreme fasting, simply stop eating at 7 p.m. and don't eat again until 7 a.m. That's it, that's the whole protocol.
During those 12 hours without food, your insulin levels finally drop to baseline, allowing your cells to restore their sensitivity to the hormone.
These 3 changes work together. Walk after meals, protein first, 12-hour window. Done consistently, they begin to lower fasting insulin in weeks. These are lifestyle changes, not replacements for any medication you've been prescribed. Always discuss what you're doing with your physician. Always. Let me tell you about a patient I'll call James, of not his real name. He came to me at 66, a retired engineer with a clean bill of health.
His glucose was 94. His A1C was 5.4. His doctor had cleared him 6 months prior. He came to me because he hadn't slept a full night in 3 years.
The first thing I ordered was a fasting insulin panel and HOMA-IR. His fasting insulin came back at 19 UU/mL. Normal is under 8.
His triglycerides were 178. His blood pressure averaged 138/86. He had gained 11 pounds around his waist in the previous 2 years.
We started the 3 changes I just described: walk, protein first, 12-hour window. In 8 weeks, his fasting insulin dropped to 7. His sleep returned. His primary care physician had no explanation. Nothing had changed except these 3 habits petted, and his blood work looked 10 years younger. So let's bring this together. 9 signs your insulin is too high right now. Skin tags, dark patches, constant hunger, brain fog, exhaustion, blood pressure, triglycerides, stubborn belly fat mo, and the most important one, you have never had your fasting insulin tested. That last one is where you start. Tomorrow, call your doctor's office, ask for a fasting insulin test and a HOMA-IR calculation. Write that down. Do it before you close this video. While you wait for that result, start the 3 changes. 10 minutes walking after meals, 20 to 30 grams of protein in the morning, 12-hour eating window.